Hello everyone, my name is Isabella and along with Cassidy and Alicia, I'm going to talk about vaccination programs for beef cattle. I'd like to start this presentation by giving you an overview of vaccines and vaccination programs. So vaccination programs are designed to protect the herd from diseases that are caused by infectious pathogens such as viruses and bacteria. What happens is the vaccine will stimulate the immune system of the animals, and that will produce a protective response against a specific disease caused by a specific organism. However, the vaccines, they cannot prevent the exposure to the infectious disease or the infectious pathogens, but they increase the animal's ability to fight off an infection and also lessen the severity of a specific disease. In cattle, usually we administer vaccines through injections, although there's some vaccines that may be given through different routes, such as intranasal or oral. A vaccination alone will not guarantee a good herd health program. There are some other factors that you have to take into consideration to have a optimal response to a specific disease or pathogen. So some of those factors are adequate nutrition, strategic deworming, and sanitation of the herd. When you're trying to develop a program, a vaccination program for your herd, it's always very important to take into consideration the type of operation that you have and also the location, and along with the herd veterinarian, develop a specific program for your herd. It's very important to ensure that the products that you're using, so the vaccines, are safe for pregnant animals and also for the calves they're nursing from the pregnant cows. It's important to proper store and administer the vaccines according to the label directions. If required, you have to respect meat withdrawal times when you use vaccines. If the vaccine requires boosters, you have to booster primary vaccinations when it's recommended, and always follow all the beef quality assurance guidelines when you're using vaccines. When you're using vaccines in breeding herds, those are the vaccines. They're primarily designed to prevent against diseases that cause reproductive losses, and some of these diseases may include failure to conceive, embryonic death, and abortion and stillbirths. Those vaccines they're using in breeding herds, they're also good because they protect the developing fetus and they provide additional benefits to the colostrum that you're going to feed the calves once they are born. So the first step in designing or evaluating a vaccination program is to know which diseases are the most likely to impact your cow-calf operation. I'm going to give you a brief overview of some of the viral and bacterial diseases that we have vaccines available for beef cattle. So I'd like to start with the infectious bovine rhinotracheitis, or IBR. This disease causes abortion in pregnant cows and respiratory diseases outbreaks in calves. And along with the respiratory disease outbreaks, we may see some eye infections. They're very similar to pink eye. These eye infections, however, they can be happening in conjunction with the respiratory diseases or not. Bovine virus diarrhea, or BVD, cause a series of reproductive problems in pregnant cows. So some of the negative effects of this disease are early embryonic death, abortion, or these animals will have calves with congenital defects. Also, BVD has an immunosuppressive effect on beef cattle. So if the animal has this disease, they're going to be less responsive to any other disease or any other pathogens that they are being exposed to. In calves, BVD causes several severe diarrhea and also some respiratory disease outbreaks. The bovine respiratory syncytial virus, or BRSV, also cause respiratory disease outbreaks in both adults and calves. And the parainfluenza, we usually see more respiratory diseases being caused on affecting calves. Some of the bacterial diseases of which we have vaccines available are leptospirosis. So in adult cows, leptospirosis can cause abortions, stillbirths, or weak-born calves. We also have a venereal disease called fibrosis, which can be spread from an infected cow to an uninfected cow via the bull. Also, when the cow is infected and pregnant, it may cause embryonic death and resorption of these embryos, which can be unnoticed by the producer. However, it may lead to infertility, and the producer will start noticing that the cows will be rebreeding several times before they finally conceive. Also, some of these cows will carry vibrosis infections throughout the whole gestation. They may deliver a normal calf, and then they will infect the bulls in the next breeding season, which can infect other cows, and the infection will continue throughout the herd. Also, clostridial diseases are some bacterial diseases that we have vaccines for. These clostridial diseases, they cause usually muscle damage, liver damage, and damage in the intestine of older animals and also cats. Brucellosis is another disease which mainly causes abortions, weak calves, and decreases the milk production with no signs of sicknesses. So this, you're gonna start seeing animals losing their pregnancy, decreasing their milk production. You'll see calves that are born very small. However, you don't see any signs on the dam that's delivering these calves and going through this negative effects of brucellosis. So now that I gave you an overview of the diseases, we're going to talk a little bit about types of vaccines. There are 3 different types of vaccines: so modified live, killed, and chemically altered organisms vaccines. So the first one I'm going to talk about is the modified live vaccines. This type of vaccines, they contain a small amount of the viruses or the bacteria that cause actually the disease, and these pathogens, they have been altered so they don't cause the clinical disease once you administer the vaccine with these live pathogens. However, these viruses or bacteria, they can still replicate in the vaccinated animal, which will result in a controlled infection. So they were not going to really cause a severe disease on these animals once they're vaccinated. The recognition of the replicating organisms by the animal immune system will stimulate a response, and that is going to be effective in case they actually end up getting the disease specific to these viruses or bacteria. There are some advantages and some disadvantages when you use modified live vaccines. Some of the advantages include that one dose is sufficient. However, sometimes you will need boosters depending on the type of the disease that you're vaccinating for. Typically, live vaccines stimulate more rapid, strong, and long-lasting type of immunity compared to killed vaccines. They are less likely to cause any allergic reaction and post-vaccination lumps compared to killed vaccines, and they're usually less expensive. Some of the disadvantages of the modified live vaccines include the risk of causing abortion or any type of infertility on animals that may be pregnant. Therefore, this live vaccine should generally be administered 6 to 8 weeks prior to the breeding season. So you don't want to give these vaccines to animals that are already pregnant or soon to be pregnant. Also, another advantage is that you have to mix these vaccines on the farm, and they have to be used on within a short period of time, or this organism may actually die and the vaccine won't work. Kill vaccines and toxoids, they have organisms or subunits of these organisms that do not replicate or reproduce themselves in the animal when after you administer these vaccines. They usually contain adjuvants or some substances that will further stimulate the immune system to respond to the vaccine challenge. They're safe to use in any animals, including animals that are about to be bred or cows that are already pregnant. So some of the advantages of the killed vaccines include that they're available for many more diseases than the modified live vaccines. There's no risk of the vaccine pathogens spread between animals. There's minimal risk of causing abortion or reproductive problems, and there's no on-farm mixing required. Some of the disadvantages that are related to the killed vaccines include that they may cause more of the allergic reactions after you give to the animal compared to the live vaccines, as well as post-vaccination lumps. There's usually 2 initial doses required for these vaccines. You have a slower onset of immunity, which means that it will take longer for the animal's immune system produce a response to the specific organism that you gave the vaccine to. The immunity is usually not as strong or long-lasting as the live compared to the live vaccines, and usually is more expensive than the modified live vaccines. We also have the chemically altered vaccines, which contain modified organisms that are grown in chemicals. So these chemicals will cause specific mutations of the specific organism. Although these vaccines, they're not going to cause the disease, they're supposed to protect against some of the animals may have a fever or reactions during a short period of time after vaccination. Some animals also may have swelling and soreness of the site of injection. And in some of the cases, some of these animals may go off feed or decrease their milk production for a few days after you vaccinate them with this chemically altered vaccines. Some of the advantage of these vaccines is that they are very similar to the modified live vaccines. Their safety is very similar to the killed vaccines, and there is minimal risk of causing abortion or any kind of reproductive problems in animals that are already pregnant or about to be bred. Some of the disadvantage is that you need 2 doses. There's a slower onset of immunity compared to the live vaccines. Immunity is usually not as strong and long-lasting as you see on the live vaccines. Usually they're more expensive than the live vaccines, and they must be used, they must be mixed and used within a short period of time at the farm. So, how do we proper handle vaccines? We have to keep in mind that the best vaccine program will fail if the product that we are using is damaged or uh, is being handled improperly. So most of the live vaccines must be reconstituted with sterile water. And once you add the water to this vaccine and you reconstitute, you have to use in a short period of time because remember this have live organisms inside, and if it takes too long for us to use it, they end up dying and the vaccine is not effective. So we have about 30 minutes to use a live vaccine after we mix it. It's very important to use a cooler or other climate controlled storage containers to protect these live vaccines after we mix and add the water to it. We should not expose them to extreme conditions such as cold, heat, and sunlight. It's very important to keep the needles and syringes clean to avoid infections at the site of injection. We should never use disinfectants to clean needles and syringes used to administer vaccines, especially when we are dealing with live vaccines. It's very important to always follow product guidelines for cleaning the vaccine syringe guns. Generally, what it should be done is to rinse thoroughly with hot water and to clean the injection equipment and then sterilize using boiling water. Do not mix different vaccines together in one syringe or combine other injectable drugs in the same syringe with vaccines because will most likely make them not effective. When we talk about the sites, the application sites, it is important to remember that the only acceptable site for injections, it should be the neck or the rib area. So if you're giving an intramuscular injection or vaccine, that means in the muscle, you should use the neck area, or a subcutaneous type of injection, you should always use the neck area. You can use the subcutaneous injection also the area of the ribs, but you should never give vaccines on the back of the animal because sometimes some of the products may cause damage, and you do not want to damage the beef, the sites where you can sell the meat for consumption. Here is an example of a vaccination schedule for cows and bulls. Some of the vaccines that are recommended and what is the schedule for them. For example, IBR is annually, BVD annually, for the parainfluenza annually, and so forth. Just remember always to develop a specific vaccination program for your herd that keeping in mind your goals, and also the vaccines that should be used at the location where your operation is.
Hello, I'm Cassidy Dossin, the Agriculture and Natural Resources Agent in Clay County. Isabella just covered a ton of information about the vaccination protocol in your herd, so I'm just going to supplement that with some specific considerations for vaccinating your calves. Even if you sell your calves at weaning, there's a ton of benefit to implementing a calf vaccination protocol. While young calves will get some immunity from colostrum, this protection is temporary, and calves need to start building their own immunities after a few months. Calves affected by bovine respiratory disease can greatly reduce profits for the producer. It's been shown that these affected calves could weigh up to 36 pounds less at weaning, and this doesn't even include the effects of continued stress of transport, holding, and commingling at the sale barn. all before the calves are weighed and you get paid. Vaccinating calves early at 2 to 3 months old allows you to get in that booster shot at or before weaning, which gives a huge jump in immunity for these calves facing new stressors when they leave your ranch. There are a couple ways to go about giving booster shots around weaning. If you're able to gather calves before weaning, giving boosters 3 to 4 weeks before weaning will provide a good immunity boost and you'll be able to ship calves right when they're weaned. But if you can't gather them up pre-weaning, wean and booster calves in the same go, but hold them 3 to 5 days before shipping to cut down on their stress and make the booster shots more effective. Like Isabella mentioned, vaccine protocols can be different for every producer, and you should consult your veterinarian on what diseases should be addressed in your program and how you schedule vaccines and boosters. But here are some basics that you might consider implementing. When you process calves at 2 to 3 months old, you can give a 7 or 8 way clostridial, commonly known as blackleg. 7 or 8 way, or you might see 4 and 5 way, refers to the number of different subtypes of a microorganism in a vaccine. These terms are most often used for leptospirosis and clostridial diseases, which contain several different subtypes. Your vet will know which vaccine might be necessary in your area. You can also give a modified live vaccine for viruses commonly associated with the bovine respiratory disease complex, which will usually include IBR, BVD, PI3, and BRSV. This vaccine can be split up so it covers fewer diseases than this, and you'll also find killed versions, so you and your vet can make decisions there. Mannheimia and Pasteurella are bacteria associated with BRD and pneumonia, so this might be another vaccine you consider for calves. That covers the basics to a calf vaccination protocol. When you're keeping heifers for replacements, this protocol might differ, and Alicia will cover that next.
If heifers are being retained as replacements for the breeding herd, they will need their own vaccination plan, separate from cows, bulls, and calves destined to be shipped. Replacement heifers should be vaccinated for Clostridium, IBR, BVD, and BRSV at 2 to 3 months of age, along with the shipping calves. These will likely be administered as combination vaccines. At weaning, replacement heifers will receive the typical booster vaccines for Clostridium and the viral diseases. However, they should also be vaccinated for vibriosis and leptospirosis at this time. A brucellosis vaccine will need to be administered by a veterinarian before the heifer reaches 12 months of age if this is a part of your vaccination protocol. Prior to breeding, the heifer should receive boosters for all vaccines except brucellosis. It is important to note that vibriosis, leptospirosis, and trichomoniasis vaccines must be administered 2 times 30 days apart, at least 30 to 60 days prior to the breeding season to mitigate any fertility impacts while still boosting immunity. Work closely with your veterinarian or extension agent to customize a vaccination program for your cow herd. A veterinarian may add or remove vaccinations that are generally recommended for most herds in your location. In addition, a veterinarian can offer objective advice on specific vaccine products. By being involved in the design of the herd health production calendar, a veterinarian will be better able to prevent disease and deal with it if it occurs. Remember to always properly store and administer vaccines according to label directions, adhere to designated meat withdrawal times, and follow all other beef quality assurance guidelines. It is also important to keep vaccination records for each individual animal or group of animals. Whether that animal is retained in your herd, such as cows, bulls, or replacement heifers, or shipped off. These records will be important in case of an outbreak of disease, questions arise regarding meat contamination, or transfer of ownership of animals. We hope this presentation has been helpful for you when developing a beef cattle vaccination program. You are welcome to contact any of the 3 presenters, Izabela, Cassidy, or Alicia, for help with your vaccination questions, or reach out to your local county extension agent for support.